Hello everyone. Today we are going to study about the clavicle bone and its fracture. So this is the most common bone to fracture in the human body. So we have to learn it. So there are peculiar feature of the clavicle, like this is the only bone which is arranged horizontally, and it is ossified in the membrane, like membranous ossification, and this is the first bone to ossify and last to the complete ossification, and the only bone of having two primary center, like other long bone have uh, generally have only one primary center, but this bone has two primary center and it is curved as shaped bone. So these are the peculiar feature of the clavicle bone. So let's go with the fractures. So this is the most common fracture in the birth and in the newborn, and overall also this is the most common fracture in this. And like the most common fracture is in the middle one third, and if not that, then we have to take the junction of the middle two third and the lateral one third. Like why there is more chance of fracture, because like middle two third is tubular and the lateral one third is flat, so in there will be more chance at the site of the joint, so like tubular and the flat joint, so uh, it is prone to the fracture. So uh, when if the fracture occurs in the clavicle, then we have to look for the x-ray, and then it will be identified, the diagnosed. And for the treatment, like we have to we can have the observation or the arm sling. We can use arm sling. It is used to bring the lateral fragments up. So for the we can use the figure of 8 bandage, which brings the medial fragment down, and if we use the arm sling, then it will bring the lateral fragment up, so that there is easy for the fixation in the healing. So for the operative indication, as if there is fracture, what are the indication to do the operative fixation, like displaced fracture and open fracture, or having multiple fracture or floating soldier. So these are the operative indication, and if there is basal and the neurovascular injury, then we have to also do the operative indication. So the complication of the clavicle bones are like malunion. So for the malunion, other bones are also affected, like we have to remember MISC. For the M malunion, I means intertrochanteric fracture. In that, like greater trochanter and the lesser trochanter, then there, if there is fracture which will read in the lower limb, so then the intertrochanteric fracture have more chance of having malunion, and the neck of femur of having non-union has more chance, so intertrochanteric fracture. And then supracondylar fracture of the humerus has also malunion as a complication, and the which we are in clavicle is also having like complication of the malunion. So there can be also neurovascular injury, like brachial plexus, subclavian vessels can also be affected, and non-union occurs very rarely, as I have mentioned here, because like the video will be very short for the clavicle. So if the non-union then come, then we have to know the mnemonics FLUTS. So for the F femur neck, as I have already also talked, like if there is fracture of the femur neck, then there is chance of the uh, non-union. But the most common complication of the femur neck fracture is avascular necrosis, and then followed by the non-union. And for the L, like lateral condyle of the humerus, and for U, ulna lower one third, and for the T, there can be body of the talus and the lower border of the tibia, and for the S, scaphoid. Scaphoid has also a chance of avascular necrosis as a complication. So what condition we can say, like there is non-union of the bone, is like if there is not union of the bone after the fracture of 9 months, and then uh, also like in the last 3 months there is no progress of healing, then we can call that fracture as a non-union. And these are the things which we need to know in the clavicle fracture. For summarizing, like middle one third is most common, and then like figure of 8 bandage, which we have to remember, and then like it is the most common fracture at the birth also and the newborn, and the most common complication is the malunion. And for the treatment, like we can do the observation, arm sling, and the 8 figure of 8 bandage can be used. Like this type of figure can be used, which is used to bring the medial fragment down. And these are the things which you need to know in the clavicle bone fracture. Thank you.